Bariatric surgery has been the only thing that has been proven to cure obesity. We know from many studies that more than 90% of people who diet and lose weight end up gaining 110% of their weight back. So dieting and exercising are limited and don't usually work. Bariatric surgery, we know from history and from studies that it's permanent or can be permanent, and it cures diabetes, cures high blood pressure, cures high cholesterol, cures sleep apnea, and makes the person just feel better overall. Today we have the gastric sleeve, which basically all we're doing is taking a stomach, which is large, and reducing it a significant amount and making it smaller, which to me is a much simpler operation, which lesser risks. That is my favorite operation today. The major risk of the gastric sleeve is that you can have a leak from the lumen, and that can cause peritonitis, which is a severe infection in the abdominal cavity, which may require further surgery and may require being in the hospital many months and may require long-term care. Thankfully, that's a very, very, very low risk. The other second risk that gastric sleeve may cause is reflux, which happens about 20% of the time. Gastric sleeve may create reflux. To try to minimize the risk of reflux in patients postoperatively, we try to repair hiatal hernia at the same time as we do the gastric sleeve. A hiatal hernia is where the esophagus enters the diaphragm. Should be an opening that is the size of the esophagus, which is basically something about the size that I'm creating here between my thumb and my finger. But because of obesity or because of heredity, that opening gets dilated and gets bigger. And that hiatal hernia as such also cause reflux. By the same token, people who suffer from reflux, by losing the weight and closing or repairing hiatal hernia, up to 90% of the time can be cured by having a gastric sleeve and hiatal hernia repaired.